everyone, my name is Shersa Jane Salminaw, and today I'm going to perform hand washing technique return demonstration. Hand hygiene is considered as a primary measure to prevent infections.
Hi everyone, my name is Kirby Alparonda from BSN First Year Section E, and I am from North Valley College Foundation Incorporated. So now we are going to perform the return demonstration about preparation of a stereofield. So before anything else, I would like to perform the hand hygiene to prevent the spread of microorganisms. And after that, we can now proceed to the preparation of the stereofield.
Before you begin, check that the mayo stand or countertop is clean and free of dust or moisture. If it is not, clean the area with disinfectant and allow it to air dry. Make sure it is entirely dry, as moisture can allow microorganisms to contaminate the pack. If you will be assisting with a surgical procedure, immediately after opening the instrument pack, perform a surgical hand scrub. Most medical offices have a limited number of autoclaved packs, so be sure to open the correct pack. Opening the wrong pack could mean not having enough sterile supplies for the next procedure. Place the instrument pack on the mayo stand or countertop and check the label again. Autoclave indicator tape changes color after the sterilization procedure, so check indicator tape for a color change. Position the package so that the outer envelope flap is facing away from you. This way, you do not have to cross over the package to open it. Open the outermost flap. Carefully lift each flap by touching only the folded back tabs without touching or crossing over the inner surface of the pack or its contents. Next, open the first flap away from your body. To prevent contamination, open the second corner by pulling it to your left side. Open the remaining 2 corners of the pack. Your sterile drape is now a sterile field from which to distribute supplies and instruments.
Good morning, everyone. My name is Rosa Stanley G. Sandoval from North Valley College Foundation Incorporated, BSN First Year, Section E. In this video, I will be presenting how to prepare a sterile field. So before that, we will be applying our hand hygiene so that there will be no further contamination of bacteria in our field. Please enjoy.
Before you begin, check that the mayo stand or countertop is clean and free of dust or moisture. If it is not, clean the area with disinfectant and allow it to air dry. Make sure it is entirely dry, as moisture can allow microorganisms to contaminate the pack. If you will be assisting with a surgical procedure, immediately after opening the instrument pack, perform a surgical hand scrub. Most medical offices have a limited number of autoclaved packs, so be sure to open the correct pack. Opening the wrong pack could mean not having enough sterile supplies for the next procedure. Place the instrument pack on the mayo stand or countertop and check the label again. Autoclave indicator tape changes color after the sterilization procedure, so check indicator tape for a color change. Position the package so that the outer envelope flap is facing away from you. This way, you do not have to cross over the package to open it. Open the outermost flap. Carefully lift each flap by touching only the folded back tabs without touching or crossing over the inner surface of the pack or its contents. Next, open the first flap away from your body. To prevent contamination, open the second corner by pulling it to your left side. Open the remaining 2 corners of the pack. Your sterile drape is now a sterile field from which to distribute supplies and instruments.
Washing. It is also defined as the antiseptic surgical scrub or antiseptic hand rub performed before donning sterile attire preoperatively. Remove rings, watches, and bracelets before beginning surgical hand asepsis. Wet hands and forearms with warm running water. Pre-wash your hands and forearm with soap. Always start rinsing from your fingertips and proceed towards your elbow. Scrub your fingernails, fingers and hands with brush and soap. Discard the brush and wash your hands and forearms. Dry your hands and forearms with a clean towel or tissue. Apply the disinfectant. As with rinsing, proceed from hands to elbow. Rub it from your hands to elbows.
Good day everyone, I am Sherlyn May J. Sakayanan, and in this video, I am going to show you the method of applying the sterile gown and the sterile gloves close method. And due to unavailability of the sterile gown, I will be using my lab gown in this video. So first, we just need to sanitize our hand through the elbow. And then, grab a paper towel to help it dry. And then we just need to open up the pouch of our sterile gown and then grab it near the collar away from our body. And then let your co-worker to close the back of your sterile gown. And in applying the sterile gloves, we just have to grab it with our non-dominant hand and put it in our dominant hand.
Making sure that it is at the top center bottom area of the table for easier application and access of the gloves. And then, we will place the right glove on the right gown sleeve, making sure that the palm of the hand inside the gown sleeve must be facing upward toward the palm of the glove. This means that the glove fingers should be pointing towards us for easier application. While our hands are still inside our mittens, we should grasp the bottom rolled cuff edge of the glove with the thumb and the index finger, and then we shall place it into the glove's rolled cuff edge at the seam that connects the sleeve to the gown cuff. This position is necessary for easier manipulation of the gloves while keeping it sterile. While holding the glove's cuff edge with one hand, we shall grasp the uppermost edge of the glove cuff with the opposite hand. Then, we will stretch the cuff of the gloves over the hands. This will create a seal that will prevent the exit of microorganisms over the operative sterile field. Pull the glove onto the hand, and we shall pull any excessive amount of glove sleeve from underneath the cuff of the glove. This is to reveal and fit the fingers onto the sterile gloves, and pulling the excessive amount of glove sleeve ensures the nurse comfortability to work. Using the hand that is now gloved, we shall now put on the second glove in the same manner. Then, we will adjust the fingers of the glove as necessary so that they will fit snugly and comfortably. We will do the same steps on the opposite hands because this will maintain the sterility of the gown, the gloves, and the work area. We are adjusting the fingers for complete comfortability and for the maximum dexterity while using the gloved hands.
Hi everyone, my name is Queen Gina Soldares. Today I'm going to perform open glove. So the very first thing we should do is we're going to wash your hands, then select the pair of gloves that fits you. So you have just sterile gloves. You can see here it's perfectly sealed. Then pull down to open. There's a little flaps on the top of it. We're going to peel this off. Then we have our gloves. So we're going to open this. As you can see, there's a little flap in between. These flaps will assist us to open the glove. We should be careful to open this so that we won't be contaminated. Then we can see here our right glove and the left glove. So be careful not to touch the outer part of the glove. Then, so I'm going to touch the glove. Be careful not to touch the outer part of the glove. Then, I'm going to slide my hand inside the glove so that it easily careful not to touch the outer part of the glove. Then, next is I'm going to insert my fingers underneath the left hand, the left glove. Then I'm going to slowly put my finger inside the glove. Then putting it inside perfectly, then we're going to arrange it safely. So we're going to arrange it. So we have our glove.
Hello everyone, I am Gwyneth Gavisatera. Today I am going to perform the open gloving return demonstration. The use of the gloves reduces the risk of contaminating the healthcare workers' hands with blood and other bodily fluids. It also reduces the risk of germ dissemination to the environment, as well as the risk of the transmission of microorganisms and other harmful pathogens to the healthcare workers and the patients and vice versa. So prior to the conduct of the procedure, I will be performing thorough hand washing first. Okay, so first, pick up the cuff of the right glove with your left hand. And be careful not to touch the outside part of the glove because this part, the outside part, is the sterile part. So insert your hand. Okay. Okay. Next, slide your fingers into the folded cuff of the left glove. So insert your fingers and you can touch it this now because this is the part of Okay, after using the gloves, you can dispose this by doing this.
Before you open the sterile surgical gloves, make sure that you should have done by medical hand washing. Next, you need to carefully open the package. Notice that there are two coverings inside. So, we have the outer package and the inner package. Grasp the inner package and lay it on a clean flat surface. Just above waist level, open the package, keeping the gloves on the wrapper. Avoid touching the gloves because that is sterile. Next, identify your right and left gloves. So each glove, this one has a cuff approximately 6.5 inches wide. Glove your dominant hand first. So my dominant hand is my right, so I will glove it first with one thumb and your first 2 fingers of your non-dominant hand. Touch only the glove's inner surface, so you will touch first the dominant glove with your non-dominant hand. So, 2 fingers and your thumb, you will grasp the inner surface. Next, carefully pull glove over your dominant hand, having a cuff and being sure that cut does not roll up to your wrist. Be sure the thumb and fingers are in proper spaces. So I fold my thumb inside my 4 fingers and that it will not touch the on sterile area, and carefully pull it again. Avoid touching the non-sterile part. Next, we have already gloved the dominant hand. Clip your 4 fingers underneath the second glove's cuff with the thumb conducted. Place your 4 fingers inside and your thumbs conducted. Carefully pull second glove over your non-dominant hand. Do not allow fingers and thumb of glove dominant hand to touch any part of your exposed dominant hand. Now, you can arrange your sterile gloves. Again, avoid touching the non-sterile part.